Health begins in our neighborhoods, at our dinner tables, and in the very air we breathe. For some New Jersey families, the foundations of good health are readily available. For far too many others, even the basics remain out of reach. When nutritious food, transportation, or accessible healthcare become challenges, entire communities feel the impact. That's why at RWJBarnabas Health, we're expanding our approach to address these fundamental needs. We're building and sustaining a healthier New Jersey by creating a framework for true community wellness across our state. This framework includes 3 critical areas that shape the health of our communities: food insecurity, access to healthcare, and the vital role of community health workers in guiding families through their health journeys. Access to nutritious food is essential for healing. Many families face challenges in accessing and affording healthy food, leading to food insecurity and poor diet quality. Too many of our neighbors face the impossible choice: pay for medicine or put a nutritious meal on the dinner table.
The Harvest Farm to Community Center is more than just a building.
It's a lifeline, bringing fresh, affordable food into the community so it can be distributed locally to those who need it most, while strengthening the local food economy. Proper nutrition fuels learning. When kids discover that healthy food can taste great too, it's a lesson that sticks, one that supports their well-being and develops good habits for life.
A healthy meal can transform a family's day. That's why RWJBarnabas Health is the first and only health system to partner with the state of New Jersey to roll out a system-wide team of SNAP navigators. Our navigators assist families and individuals in applying for and maintaining SNAP food assistance benefits, ensuring more households are able to put healthy meals on their tables. Too often, patients leave the hospital or a physician's office following every doctor's order, only to return weeks later, not because their treatment failed, but because their refrigerator stood empty. Food pharmacies bridge this critical gap.
Now, as patients leave our care, they do so with more than just a prescription for medication. They leave with healthy food and the knowledge of how to prepare it. It's world-class healthcare and proper nutrition all under one roof.
Working with local farms means vegetables grown right here in New Jersey are reaching the families who need them most. This is what holistic health looks like, connecting local farmers directly to community wellness. And rain or shine, our farmers continue their mission of growing fresh, nourishing produce.
Healthcare should not require crossing the city, the county, or the state. It should be as close as a neighbor, as familiar as a friend, ready when you need it most. That's why health centers are expanding across our state, bringing quality care to neighborhoods where families have gone too long without the basics, ensuring no one is turned away, regardless of their ability to pay. We're embedding primary care physicians and specialists directly in these communities, making it easier for residents to access comprehensive care close to home.
Our health centers aren't just clinics. They're community anchors that offer primary care, mental health services, and connections to resources that address the whole person. Before we opened this clinic at Eastside High, families often had to miss work or school and travel far, often without a means of transportation, just to get care. Now, students and their families can access health services right in their neighborhood. Whether it's after school, after drop-off, or whenever they need it, that's what removing barriers truly looks like.
A missed appointment isn't just a scheduling problem. It's a mother choosing between seeing her doctor or missing work. It's an older adult with no way to travel across town. These everyday barriers quietly shape health outcomes.
With our fleet of transportation vehicles and our rideshare partnership, we can arrange transportation for eligible patients. A ride is scheduled, they get a notification, and then they arrive safely for their appointment.
Community health workers serve as vital bridges between healthcare and home. Coming from the neighborhoods they serve, they bring understanding and trust to every doorstep. For months, they walk alongside patients, helping navigate life's basic challenges that medicine alone cannot solve. finding safe housing, putting food on the table, or simply getting to a doctor's appointment.
It's not just about treating illness. It's about addressing the everyday barriers that prevent people from staying healthy in the first place.
Many of our patients are dealing with so much beyond their medical conditions. One day we're helping someone apply for food assistance, the next moment we're arranging transportation to appointments, and sometimes even connecting them with housing resources.
There was a gentleman who kept coming back to the emergency room.
It turned out he couldn't afford his medication and didn't have reliable transportation to his follow-up appointments. Now he has a primary care doctor he sees regularly, medication assistance, and hasn't been back to the ER in months. And this is what makes community health workers such valuable assets to the community and to the health system.
Collaboration is at the very heart of our work, and we are so incredibly grateful for the partnership of local leaders, government officials, and stakeholders statewide who help us advance health and well-being in every community we serve.
Healthcare doesn't just happen in hospitals. It happens in school cafeterias, in community gardens, or on the bus ride to a doctor's appointment. When people ask me what makes me proud about RWJBarnabas Health, I tell them it's our dedication to providing more than just healthcare. I take great pride in our commitment to offering these services and many more to the communities we serve day in, day out, not just when there's a crisis. This is just the beginning. We're committed to growing these initiatives, reaching more communities, and continuing to address the real factors that determine health and well-being in New Jersey.